Mycobacterium. So here we actually asked to talk about primary and secondary pulmonary tuberculosis. Primary and secondary pulmonary tuberculosis, right? So quickly talk about them, trying to establish the differences between the primary and the secondary. So talking about the primary first, we said that primary tuberculosis is the first infection with Mycobacterium tuberculosis. So it usually happens when someone inhales droplets carrying the bacteria. Okay. So the infection often begins in the mid-lung zones. It forms a small granulomatous lesion called the Ghon's focus. So if nearby lymph nodes are involved, it becomes the Ghon's complex. Okay. So most healthy individuals don't develop severe illness at that stage. Okay. You have things some subtle symptoms like low-grade fever, cough, chest discomfort. So in children or people that have weak immune system, however, the infection can now spread widely, okay, leading to miliary tuberculosis or tuberculosis meningitis, where having inflammation of the meninges due to tuberculosis. So radiologically, primary tuberculosis shows what? Small parenchymal lesions, hilar lymph node enlargement. In many cases, the bacteria become dormant, leading to latent TB. Okay. So what is a secondary TB? A secondary TB occurs when the person was previously infected, but the infection went low. Okay, lay low. Okay. So you have a dormant bacteria from a previous infection, and it became active again. One of the reasons why it could actually become active again is a weak immune system. Okay, so this form is much more destructive. It typically affects the apices of the lungs. This is where oxygen is usually being stored so much. Okay, so the immune system mounts a strong response. Okay, and this further destroys the lungs. So secondary TB is more severe. Okay, patients experience what? Chronic cough, blood-stained sputum, weight loss, night sweats, fever. So because of the cavitary lesions, this form is highly infectious, that people having secondary tuberculosis can easily spread it to other people too. Okay, so bacilli are easily released in the airways. Radiologically, you see a lot of cavities, you see a lot of fibrosis, that's dead tissues, and the upper lobe is much more involved. So it can even spread to other lungs where you are having an extra pulmonary tuberculosis. So basically, this forms a discussion on what is a primary and a secondary pulmonary tuberculosis.